Hi, I'm Tania from Alston and Bird's Healthcare Group, and I'm joined by my colleague, Sean Sullivan, to discuss the latest development at CMS towards modernizing payment and coverage rules, which really recognizes the value of digital healthcare.
Yeah, Tania, there were some interesting new codes for remote therapeutic monitoring, or RTM, in the 2022 Medicare Physician Fee Schedule proposed rule that was released on by CMS on July 13th. These follow on the heels of the RPM, or remote physiological monitoring codes, that were adopted and developed over the last couple of years. These new RTM codes are modeled on those RPM codes, and they share some similarities, but they do have some important differences.
That's right. There are 5 new RTM codes that serve as counterparts to the 5 primary RPM codes. And both types of codes cover monitoring and management services involving the remote collection of patient data that's transmitted electronically through a device or software that meets the FDA definition of a medical device. But while RPM codes currently require the data to be transmitted automatically by a connected device, the newer RTM codes, as proposed, would permit self-reported data by the patient as well. And there are other important differences too, as they're intended to serve a bit different purposes.
Yes, so while the RPM codes specifically target physiologic data, such as blood pressure, glucose monitoring, and pulse oximetry, for example, RTM is for the collection of non-physiological information. And neither CMS nor the AMA has yet defined physiologic versus non-physiologic, but we do know that the RTM code descriptors include things like musculoskeletal system status, respiratory system status, therapy or medication adherence, and therapy or medication response, as well as pain. So until now, though, there haven't been any CPT codes to describe remote patient monitoring of therapeutic interventions through devices such as inhaler usage sensors or smart pill reminder systems. So while the potential for applications for RTM are still to be determined, CMS is seeking comment on the types and costs of devices that might be useful for this type of monitoring and to appropriately value those RTM codes, and specifically the ones related to practice expense.
Exactly, and CMS is still working out some of the kinks as well. I think one of the bigger questions is who will be able to bill for these RTM codes. CMS acknowledged that the architects and stakeholders of the RTM codes suggested that the new codes were created as general medicine codes instead of E&M, so that practitioners like physical therapists who cannot bill for RPM would be able to bill for the new RTM codes. However, CMS also noted that due to a quirk related to code composition, because the new codes were modeled on RPM codes, which are designed to be billable on an incident-to basis, since a lot of the time it's clinical staff who are performing that work, technically the RTM codes can also be billed only by physicians and NPPs or non-physician practitioners who are qualified to supervise incident-to services. And even more challenging is that the level of supervision that would be required for these RTM services would be more stringent than the one currently required for RPM. And that's because CMS designated RPM as care management services to enable them to be provided under general supervision instead of direct supervision, which, as we know, general supervision can be provided remotely, whereas direct supervision requires on-site presence by the supervising physician or NPP. So it's a little ironic, but precisely because RTM codes are not classified as E&M, they're also not eligible to be designated as care management services. So by default, they're subject to direct supervision. The good news is that CMS recognizes that this wouldn't promote their aims of breaking down barriers to digital healthcare, and CMS is seeking comment on how to remedy these issues related to the code construction.
So more to come on this, but feel free to reach out to us to discuss the steps that you can take now to develop an RTM program. And thanks for joining us on this Healthy Byte.